neuroradiology in brain imaging in the clinical setting is usually very helpful in the situations where we have a tumor, where we can pinpoint the lesion, say how big it is, where it is, what is compressing. The problem sometimes with neuropsychiatric diseases is that the imaging findings are subtle or unspecific or even sometimes not existent. This can create some frustration from the patients and from the doctors who request the MRI exams. It is important for the neuroradiologists to talk with the neurosurgeons, neurologists, psychiatrists, and try to discuss the findings. And sometimes we can achieve a better diagnosis or a faster diagnosis. I have a good example on the different perspectives that sometimes the patient and the family can have on a patient situation and on brain imaging. There's a patient with multiple sclerosis and a chronic pain syndrome, a severe chronic pain syndrome for 2 years, bedridden, that after his brain and spinal cord scan volunteers for a research on chronic pain. I wondered why would he volunteer being bedridden and in such suffering, and he told me that it would help in advancing knowledge in pain in multiple sclerosis, of course, but he was also interested in trying to make his family and doctors to understand better his pain. In the imaging exam, I found a lesion in the spinal cord that could be responsible for his pain. And when I was just saying goodbye to the patient, his family wanted to talk to me in private. And the first thing they asked me was, "Oh, so doctor, the pain is imaginary, isn't it?" And I had to use the power of the image to try to explain them, no, it wasn't imaginary, it was real, and they would have to take care of the patient better. The best way is always discussion between the clinicians involved, neuroradiologists, psychiatrists, neurologists, but also with trying to talk through with the patients about their expectations about imaging. I don't want to be misinterpreted, so neuroradiology can be of help in diagnosing neuropsychiatric diseases, but advancing research in MRI especially can help us to integrate advanced MRI modalities in the clinical practice, like spectroscopy, automated methods of measuring the volume of certain structures in the brain, etc. It is also necessary to be careful in bringing these techniques into the clinical practice, because they should only be used when we're certain that they can give us some answers and not to complicate further the diagnosis.